For a lot of people thinking about moving here, healthcare isn't a detail. It's the whole decision. So let's answer it honestly. How good is medical care in Mérida? What does it cost? And where are the real gaps? The short version, up front, for a city its size, Mérida's private healthcare is genuinely strong. But strong comes with fine print, and that's what nobody tells you. 3 parts: the quality, the cost, and the honest limits. Start with quality. Mérida has 4 major private hospitals: Star Médica, Clínica de Mérida, Centro Médico de las Américas, and Faro del Mayab. Between them, they cover most of what you'd expect from a modern hospital. One stands out for the skeptics. Faro del Mayab belongs to CHRISTUS Health, a large international system, and carries Joint Commission International accreditation, the same global standard top US hospitals are measured against. That's a real credential, not marketing. Just as important for day-to-day life, many doctors trained abroad and speak English, and you can often see a specialist this week, not in 3 months. For a lot of expats, that access is the pleasant shock. Now cost, the part that sounds too good to be true. Broadly, private care here runs 30 to 70% less than the equivalent in the United States. A private specialist consultation typically costs around 900 to 2,000 pesos, most near 1,200, roughly $65. Routine things: a consultation, basic labs, common medications, a dental cleaning, are cheap enough that many people simply pay out of pocket and skip insurance for the small stuff entirely. Here's the first piece of fine print. Cheap consultations do not mean cheap catastrophes. A serious surgery, a long hospital stay, or a major emergency can still cost real money. Far less than the US, but not pocket change. Which is why insurance is the real conversation. Your options are roughly 3: private Mexican health insurance, an international policy, or self-insuring for the small things and keeping savings for the big ones. Each works for different people. The honest catch with insurance: premiums climb steeply with age, and pre-existing conditions can be excluded or make coverage expensive. The time to get quotes is before you move, not after something happens. This is the single most common regret people voice here. A quick word on the public system. Mexico has public health care, and residents can enroll in IMSS. But as a newcomer, expect enrollment rules, waiting periods, and long queues. Most expats treat it as a backstop, not their main plan, and rely on affordable private care instead. The other real gap: the most specialized cutting-edge procedures sometimes still mean traveling to Mexico City or back home. Mérida covers the vast majority of needs, but vast majority isn't everything. Know that going in. 2 practical moves that cost nothing. Keep your key medical facts: conditions, medications, allergies, blood type, translated into Spanish on your phone. And know which hospital you'd go to and whether it has English-speaking staff before an emergency, not during one. The honest bottom line: for everyday health and most serious needs, Mérida punches well above its weight. High quality, low cost, real access. The barrier isn't the medicine, it's planning the insurance before you need it. My free Moving to Yucatan guide covers the honest picture in one place: the heat, safety, cost of living, and the language barrier. Links in the description. And if you're weighing a move around a specific health need, proximity to a hospital, a neighborhood near the right specialists, that's worth mapping out before you choose where to live. I'm Yucatan Unlocked. See you in the next one.